Hi everyone. Hi everyone. Nurse Cat Pink here. Today we're going to talk about how to take an IUD out. And this is kind of two purposes. So number one, if you have any concerns or fears about how the IUD is taken out, like maybe you have an upcoming doctor, nurse practitioner, or midwife appointment to remove your IUD and you're feeling nervous, hopefully this can reassure you that it's super quick and easy and it'll be over with before you know it. And number two, if you're someone who's DIY and wants to do this on your own at home, you actually can. I'm not recommending or endorsing doing it at home, but also I want to acknowledge that there are some scenarios and situations where it's okay, safe, and healthy, and maybe better for you in your life to do stuff on your own. With the disclaimer that always talk to your doctor, nurse practitioner, midwife before you do something medically with your body, just at least to get the full benefits and risk for your specific health situation before doing something, and never do any self-treatment based on recommendations from a random person on YouTube like me. All right, so I'm coming to you from the perspective of having trained in midwifery and having a certification as a women's health nurse practitioner, who's someone who's put in a bunch of IUDs, and I've done a lot of IUD removals in my career. And I think something I hear all the time from patients is after I remove their IUD, they're like, that's it? That was it? It's way quicker than getting your IUD put in. To have your IUD placed, it probably took you, your visit probably lasted anywhere between 15 to 20 minutes from the start of your visit with your healthcare provider all the way to the end when the IUD was in. Could have even been longer depending on anatomy and that type of thing. But here's my little handy dandy model for the IUD. So this is an IUD replica, and this is representing the uterus, the fallopian tubes here. And this is the string, so the cervix would be here, that little donut bottom part of between the uterus and the vagina. This is not life-size, but the actual uterus that real people have is actually, it's not much bigger than this in the non-pregnant state. So it's kind of accurate, not quite. So in order to take this out, you'll be in a reclining position. You'll be lying down. Your feet will be in the footrest, so your legs will be open on the exam table, just like whenever you get a PAP or you have a vaginal exam or something gynecology related, your legs are open. Not comfortable, but it should be super quick. And once you're in that position, what I do is I talk to my patients every step of the way, and I tell them before I do something, I tell them what I'm going to do. And I tell them at any point you need to stop, you tell me. That's called trauma-informed healthcare. It's something that I practice and something that all women's health providers or anybody working with anybody in any type of minority population, whether it be gender minority or different minority, should be using trauma-informed practices, in my opinion. But they'll hopefully be telling you what they're going to be doing. So if it were me, I would say, okay, now that you're in this position, I'm just going to first look at the outside, just so I can document that everything looks normal on the outside of the vagina, like so the vulvar exam. And what I'll be doing next is I'll place a speculum. Let me see if I have one. Oh, I actually have one here. It's wrapped. But I'll be placing a speculum. Okay, sorry, this is like a brand new one. So it's just this little guy that opens and closes, and then only this amount goes into the vagina. So it's not this whole thing, and it goes in when it's closed. So it goes in like only that amount. And then when we open it, so now it's wider, then we can see the cervix, so the part that's at the bottom of the uterus. So when we open the speculum, that helps the provider see this part here. The first thing they'll do is find the strings. So they might use a cotton swab, a big cotton swab like this. You probably wouldn't feel anything at this part. It would be placed into the vagina to perhaps clear some normal vaginal discharge or fluid out of the way if they can't see the strings right away. What I like to do on my exams is actually I almost touch the strings to get a good visualization of them and confirm that it is the IUD strings and not just a strand of normal cervical mucus discharge type of thing. So once I see that and I have a good visualization of where the strings are, and there is pressure throughout this whole part when the speculum's inside of you, because anytime we expand the vagina, it feels like pressure. It should not be painful or pinchy, so definitely tell your doctor, nurse, midwife, whoever's doing it, the exam, that it's pinching. If it feels pinchy, it shouldn't feel pinchy. And if it's too uncomfortable, tell them so they can change what they're doing. So the next thing that we do, and then hopefully you're not scared at this part, I'm going to tell you why you shouldn't be scared, but I know these look like scissors, but they're not. So through the speculum, we would bring in this little blunt edged, it's not sharp, not at all. This is a grabber. Basically, we would put this through the speculum and we would clasp onto the strings here. You might hear a clicking sound when we do that. And this, now I have a hold of this. So what the provider is going to do next is they might say, okay, take a big deep breath in and then slowly let it out. And they might have a different method, but basically it's to kind of distract the brain from the initial cramping discomfort that could happen when this is taken out. Some people have no cramping. Some people have a large cramp, which when this is pulled out. So my thing is I'll say, okay, take a big breath in, and when you let it out, I'm going to bring out your IUD. So I tell the person what I'm doing. So the patient or you go, and then I ask how you feel, and you say, great. And I say, your IUD's out, and you're like, what? Really? And it's just that quick and easy. Again, some people will have some cramping, some people won't. I always offer my patients, do you want to look at your IUD? Do you want to see it? And that's something you can ask for or ask not to be shown. So if you're someone who was really interested in seeing what was in your body or seeing medical devices, etc., you can ask to see it. If you're someone who gets kind of queasy or woozy with stuff that has to do with the body or medical procedures, maybe don't ask to see it or tell them, I don't want to see it if it's offered. But I'd say like maybe half of my patients are like super interested in looking at this, and I'll hold it up to them. I don't give it to them because it's often has some blood on it and some mucus. And I say, this was inside you. This is what kept you from pregnancy or kept you from bleeding too much, whatever the reason they were using it for. It has so many different uses. And the nice thing is that it's like a mental confirmation for you of like, okay, it's out. I saw it. I wasn't just told it's out. I know it's out. I saw it. So it can be nice to see it. And then we get rid of it. We toss it. You might have a new IUD placed at that visit. So like if your IUD was expired, you can totally get a new one at that same time, or they might have you come back to put one in. It's best to put a new one in right away at that visit. But that's pretty much it. After the procedure, you might have a teeny bit of cramping or like spotting, but 99% of people feel totally fine after. They go right back to work or whatever it is that they were doing after the IUD is removed. I haven't heard of anyone having persistent cramps that last more than 15 minutes that requires them to like miss work or hide out in a room and lie down the rest of the day. It's just, I think there would be something else concerning going on emotionally, physically, mentally, if that were the case. And follow up with your healthcare provider if that does happen to you. If you're like feeling knocked out a few hours after the removal, that's not normal. Talk to your provider. But it's like super quick and easy. Now, at the beginning of this video, I did mention how to DIY at home. You have to be pretty crafty because remember, in your doctor's office, they have the special tools of the speculum. So, and again, I'm sorry this is not unwrapped. I'll unwrap it for another video, but they have the speculum that they use to visualize the cervix, which you can't do yourself at home. You'll probably need somebody to help you if you're going to remove your IUD at home. So it'd be pretty tricky to get without being able to see your cervix like the provider does with the speculum. Like you're blindly trying to get your fingers up to the cervix to pull on that IUD. And you don't have this at home too, this clamp or tenaculum as we call it. So without this clamp and this speculum where we quickly can see the strings, we grasp the strings, we pull it out. At home, if you're by yourself, you're blindly doing a blind sweep trying to find the strings. Often the strings are wrapped up around the cervix or even in the small hole, that center donut hole of the cervix, which can be pretty hard to find just with your own fingers. If you have a partner in crime, a partner to help you support this situation of pulling it out yourself, that might be better because it's just the position of going onto oneself, of like trying to bend over and find one's own cervix and where those strings are is pretty hard. Not that you couldn't do it, but I wouldn't recommend trying it on your own in general. But if you have a really skilled, committed partner who's willing to search and you're comfortable enough, it's probably going to be pretty uncomfortable. Like even more than a speculum is someone's 1 or 2 fingers pressing around the cervix, trying to find a string blindly, just with their fingertips. I would recommend, if this is someone that you don't know well and you don't know their sexual history well, like ask them to wear gloves, because you just, or if they haven't washed their hands, ask them to wear gloves, that type of thing, just to keep it clean. You know, there's no huge risk there, but just to be safe. And then let's say the partner did find the string. So I'm just gonna put this little model back inside here real quick. I should use my IUD model inserter, but I'm just gonna we do not insert IUDs that way. Okay, so this should not be down here. Pretend it's in the uterus. So let's say your partner was blindly feeling around and they're like, oh, I think I feel the string. I think I got it. They could actually try to grab it and pull it. So if they felt like they felt it, they could just pull, and they might say, okay, I think I have it, I'm pulling it. And then it should come out. The reason this is not coming right out is because the folded arms are down here, which should not happen in real life. But it should come out quite easily, actually. It's hard to accidentally pull out, but if someone was intentionally pulling on those strings, in theory, they could, with some good traction, bring it out. So, I mean, just by blindly grasping the strings and pulling it out, you could actually remove it at home yourself. Now, there's many different reasons I would recommend not doing that. If you have access to a healthcare provider whom you trust to take it out, it's going to be easier for you. It'll actually be less uncomfortable for you, most likely. And it's quicker. It's a lot quicker. But I know that there's some people out there that you might even just be reassured by the idea that if you needed to, you and your partner could take it out. So even just that psychological knowing that it's not like stuck in you permanently forever. If there was an apocalypse, it could come out without needing to go to a gynecologist. So that's real. That's something that has been done by some people and can be done, but it's harder. So it's just easier to go to your doctor, midwife, or nurse practitioner. And I would definitely recommend doing that if you have access to that. So it's a benefit of having healthcare, right? Or having a clinic, is you can get that care that you need. Okay, so that's pretty much it on the removal of the IUD. Quick, painless, fast. I recommend you getting it removed by a healthcare provider. Try not to do it at home unless you have some type of super unique situation where you absolutely feel like you need to. But always talk to your provider first. Definitely leave me a comment if you have any questions or concerns about IUD removal. I'm sure there's a burning question you have that I'm not hitting on, but usually when I talk to my patients, the biggest concern is like, what is it like? Does it take as much time or effort as it did putting it in? And the answer is no, it's very quick. And all of my patients are like, what? That was it, really? When it's out. And yeah, so Nurse Cat Pink signing out. Thanks everyone. Have a good rest of your day.